Margaret, may I ask you to introduce yourself, please?
My name is Margaret Doherty. I'm the director of the Art of Dying Well, a centre at St Mary's University in Twickenham. And I'm also a trustee of the Hospice St Joseph's in Hackney. And I'm here today, Zara invited me here because of the work that I've been doing with Demos, the think tank Demos, and their Centre for Social Media Analysis, which has been very kindly supported by the Plato Trust. And that research is looking at the voices of the dying, the voices of the bereaved, and the voices of those who care for the dying. And I'll tell you a bit more about that as the panel discussion moves on.
I just wanted to say, I'm sorry I had my head down a bit there, Margaret, because we have had some problems with people being able to sign in today. And one of those people is very important to us because they're not here yet, which is John, one of our panelists. So I was just trying to type to him. So please, can I move on to you then, Rob?
Yeah, sure. So my name's Rob, and I am the Healthcare Alliance Manager for NVIDIA in Europe, the Middle East and Africa. I also have a more technical role with NVIDIA that's known in the industry as a DevRel. My background, I joined NVIDIA about 6 months ago. My background prior to that was in clinical medicine. I think I've been an NHS doctor for a little over a decade, and my journey into AI really began as a junior doctor, where a number of experiences I had really set me thinking about how modern medicine, modern perhaps in inverted commas, remains so dependent on human judgment and decisions made by human beings who are subject to all the human flaws. At a time when, when I was practicing as a junior doctor, the consumer internet was in full swing. Everyone had iPhones, 747 airplanes practically flew themselves. And it really felt like technology was not being adopted and leveraged in medicine the way I felt like it should have been. And I kind of flirted with a bit of computer programming. I was always a nerd as a teenager, and I had an idea I could probably do it. And I thought, if not someone of my generation, then who? So I got quite into software engineering alongside my clinical career, had an opportunity to join a doctoral program in AI research at the School of Computing in Ulster University, Northern Ireland. And just sort of snowballed from there. Last year during the pandemic, was very involved in the response because I had one foot in the computer modeling camp and one foot in the clinical camp. I finally joined NVIDIA, who I suspect most people on a call like this know of NVIDIA and know that they are no longer a video games company, but actually NVIDIA make the world's leading AI platform. So from my vantage point, it's a great place to be to observe and drive the change I want to see in 21st century medicine.
Hi there, Sarah. Could you introduce yourself? I know John is trying to get online. That's why I was trying to not have my head moving too far. Please go on, Sarah.
Sure. Hi. So my name's Sarah Culkin. I'm the head of analytics at NHSX. For those who don't know, NHSX is a joint unit that's been formed about 2 years ago now between NHS England and Improvement and the Department of Health and Social Care to drive forward all things kind of digital transformation within the health and care sector. So looking at and leading on strategy and policy and implementation around data, digital and technology in health and care. The bit that I lead on is the analytics unit. So my background is that I've worked as an analyst and a data scientist for longer than I'd like to admit in various bits of the health system. I set up a small data science team in the Department of Health and Social Care, its first foray into data science a number of years ago, and now lead a team that looks at a range of analytics and data science applications in health and care. For example, we support the AI lab within NHSX. We have a range of our own data science projects, and we also support teams with various analytical elements of digital transformation programs.
I just want to let you know that I've now been able to, I'm now going to be able to introduce John Pitts. Would you like to introduce yourself, John, just to say kind of why you're here today?
That's a very good question.
Sorry, why are you here? I'm so sorry I brought you into this. Is that okay?
No, don't be silly. No, it's absolutely fine, and it's a pleasure to be here. And apologies for being late. I don't usually use Zoom, bizarrely. We use other systems, so apologies. I had to sign up. Anyway, I'm here. I'm probably, I don't know whether I'm an outlier in the virtual room, but My background originally is performance science, so originally sports science. I have an academic background also in performance psychology and also more latterly neuroscience. I've worked in many different roles across Olympic disciplines around the world. More latterly, I've headed up human performance for Red Bull Formula One. And that's where I really came into seeing that there was technology finally available, which obviously is deployed on the car and the production of the car, that could truly allow us to bring together most of the human science disciplines in a way that we could really start to make the data work. So I have a company called IHP Analytics, which is a vehicle with PwC Global, which is basically human analytics in the workplace, where we apply human science and data technology to different problems or areas of corporate well-being, be it the future of work or well-being or performance or whatever it might be. So yeah, very much a blend of sort of human science and technology, and sort of starting to get into things like machine learning and pattern analysis and that sort of thing. So that's me.
Hello, thanks John, thanks for joining us. Sorry we were horribly on Zoom because I know it's annoying for some people, but I didn't realise beforehand. So just to say that I would like to move on to the question for this discussion. So that's bringing AI to the point of care. Margaret, would you feel that you could start us on that?
Love to, Zara. And I should have stressed actually that the research project is an AI project, and so that's why there's a particular lens from which I speak today. Cicely Saunders said, sorry?
Would you like to speak more about your project?
Yeah, of course. So this, I suppose, was a prescient project because I conceived it probably about 20 months ago, because knowing in the work that we do in the Centre for the Art of Dying Well, we would have to look at data and really look at the needs of those who were dying, those who care for the dying and the bereaved. And hence the conversation began with Demos and its Centre for Social Media Analysis. And we began together to put together this project. And obviously we took it through our ethics committee, and it was scrutinised and it was approved. And we are looking at data at an aggregate level, so it's beyond re-identification. And what we're doing is we're looking at, we're collecting data from public forums, because within those public forums, people are speaking about death, and they're speaking about the pandemic, and they're speaking about things that they might not be speaking to with anybody else. And within these forums, they are finding comfort and solace. And they are places that we need to discover more. So in a way, it's AI for the force for good. We're still at the point of collection at the moment. So the collection is looking at pre-COVID and during COVID. And then obviously it will be moving on to the data analysis. But Cicely Saunders, the great pioneer in palliative care, said how we die lives in the memory of those who live on. And that's why I think with regards to AI and the pandemic and how we move forward into a hope-filled future, is that we need to listen. And just as the NHS has thrown open the doors wide to innovation and so successfully, and how the technologists have really listened, there's also a place of listening to those who have been directly impacted, because what we want for all is for our loved ones and for ourselves to have a good death.
Thank you. Can I move on to Rob? Would you like to respond on that? Because I know that you had a response the other day. Is it okay for you to go on from there, and then Sarah?
Yeah, of course. I mean, I think it's really interesting. It was great to hear just when we spoke the other day, Margaret, about your work in this field, because I think dying in some ways epitomizes the process of palliative care, epitomizes that part of medicine that people balk at the idea of anything to do with machines becoming involved, because it's such a human-centric aspect of medicine. It's all about meeting the needs of the individual. It's about understanding them, and it's about empathy. of course, which is something that machines aren't capable of. So I think it's a wonderful example of using AI for good in that particular field. I'd be interested to know, have you encountered any major challenges to the work you're doing? Was it difficult to get the data? Was it difficult to get buy-in for this project? Have there been any barriers?
Well, it's interesting because palliative care, as you'll know, is hugely underfunded, and there are challenges because obviously you're working with vulnerable groups. But what was interesting about this research project is it being innovative and also using unobtrusive research methods, that really has been a huge help. And the very fact that we are able in an ethical way to listen to as I said, the voices of the dying, those who care for the dying and the bereaved. In terms of the team that we have alongside us, obviously we have the expertise, the great expertise from Demos and its Centre for Social Media Analysis, but also we have a public health practitioner, a couple of palliative care physicians, a lawyer and an ethicist. So in our ongoing conversations, we're together, so everything is done well. And the other thing that I should have added from the beginning was that at the online scoping stage, we spoke to those who were already trusted advisors in the social media spaces, of which, Rob, you'll know there are many doctors who are very generous with their time on social media, and they've become social media advisors and trusted advisors. Similarly, palliative care physicians. So it's been that there have been challenges, but to be honest, not that many, because people saw that this was something that was going to be valuable to all.
Rob, did you want to reflect on your general thoughts on the topic, on the subject?
Yeah, I think what you said was really interesting, about people could see the value in it and therefore they were on board. And I guess that leads on to perhaps something that might maybe Sarah and John want to come in on, which is that I think often, availability of data is a major barrier at the moment that we're seeing in artificial intelligence. And AI can do so much good, but people often firstly, they don't appreciate what it can do for them. And secondly, they're often not aware of research projects that they may want to contribute their data to if they knew that they were ongoing. But this is probably one for you, Sarah, because it's NHSX and it's very much strategy and policy. What are your thoughts about generally how well informed we are as a nation about how our data is used, and whether people, if they knew more, would want to contribute more?
It's an excellent question, and I have to admit that I am far from an IG expert, but certainly someone who lives in the world of trying to use data. And throughout my career, despite working in the central role within government, many times have I been told, "Oh, you can't see that data." It is a challenge. So please rest assured that it is just as challenging when you sit in a central position as it is outside of perhaps some of the central government roles. And I suspect that an awful lot of people probably think we're doing this already and are amazed that their data isn't being used this way. They would find that more shocking than it being shared. And I think that having that kind of voice present is vitally important. I would be interested to hear other reflections from trying to use data from different parts of the sector and the system.
I could certainly reflect on that. I wonder, will I bounce that to John? Maybe just to, I know you haven't spoken yet, John.
It's funny because I just John and I were doing a bit of side communication here.
Oh, yeah, sorry, that wasn't my intention.
No, sorry, thank you. No, look, first of all, fascinating topic, and I think, albeit, I think I've always sought in my roles to bring data in to, really enrich the conversations. When you're trying to enhance performance or whatever it might be, everybody sees the world differently, and trying to bring together those viewpoints is one of the first things. And forgive the Formula One analogy, but my job is always about balancing between scientific rigor and getting rubber on the road. So, in most sport, there's a clock ticking. You've got to perform, you've got to get results, otherwise you're out the door. But what I was thinking, listening listening to you guys talk is that we're finding that more and more people are far more open to using their data if they can see a value. And what we often talk, I mean, the key word obviously is trust, isn't it? When you get into how people use their data. But we found if it's orientated in the right way, we've gone through a huge process with PwC, who you can imagine are probably one of the most risk-averse companies in the world. So from a GDPR point of view and a data security point of view, we've gone through an enormous amount of rigor to make sure that we can satisfy this company from that. And I think what we're expecting, people are more than happy to put data on the internet or on something like Strava or Facebook, which, frankly, anybody who wants to get their hands on could probably make some mischief. And I just think it's an education piece. I think we found ourselves where we want to be from a human analytics point of view in our world. It is kind of light years away from where the world's ready for. And we're finding ourselves going through, sort of dialing ourselves back and saying, hang on a minute, where is the world right now? And what can we do with the data? So rather than sort of go crashing in, and companies like Microsoft recently have come crashing in and gone, right, human analytics. And they're all sort of data scientists looking at human data and going, oh, hang on, how can we work with human data? Whereas we're a human science company trying to use the technology. And I think that's an important distinction. So there's an education piece around, and also a journey. We're sort of almost kind of laying a line of breadcrumbs for what we want to do. We know where we want to get to. We're a million miles away from that. So we're sort of starting somewhere where we can build trust in how technology is used. And our intention is that, data becomes an everyday part of, what we use to make things better for people, whether it's palliative care or, whether it's in the NHS, getting comfortable with the fact that it can really help decision-making, but it's just got to be framed right in the first place.
Yeah, I think that's so true, isn't it? And what you said about it being an education issue is, I think, spot on. And I think one of the things we briefly discussed before today was the fact that there's a big knowledge gulf right now, because AI, what we now refer to as AI, is machine learning, right? And particularly when you get into deep learning, I mean, it's seriously complicated stuff. So there's a knowledge gulf between what your ordinary person understands, what your clinician understands, which is the same as what your ordinary person understands, and then what the people in the field understand. And it's really interesting to wonder to think about how we bridge that gulf. I think, I mean, I've been working with computers for like 15 years at quite a deep level. I mean 5 or 10 years very intensely. And still, some of the people I work with at a company like NVIDIA, they just leave me in the dust. Their understanding of this stuff is unreal. And so I wonder how, I'd be really interested to know from Sarah, your thoughts on the strategy, and from Margaret, your experience of the research that you've been doing, and how you went about educating people in how AI was going to transform their data.
Who would like to take that one first? Sarah, you okay too?
Yeah, happy to do that. So
Rob's done a great job, actually. I should have sort of, as it were, employed you as moderator as well, because I could have just sat back.
Just tell me to shut up whenever you want, Sarah.
No, it's not a hint. It's an absolutely yes, please carry on. Sorry, Sarah.
No, thanks. So in terms of how I've approached trying to do data science, it is really, to be honest, to start small. You've got to, and it's the same way that I've approached doing analysis all my life, really, is that ultimately the results of the work you do need to be bought into by the people who you're doing it for. And so if you produce an incredibly complicated neural network that you can't explain, then people aren't going to have faith in the results. However, if you can do a piece of work which people can really understand and it's quite simple, it takes them on a journey. And I think that actually Margaret's example is a brilliant example, because it's, number one, it's text-based data, which is something that we've really struggled to get to grips with in the past. But ultimately, it's data that people understand. We use it all day, every day. You know, we write text to each other, we write on the internet, we write emails to each other, we read the newspaper, we understand in, you know, very easy to grasp what free text is. And equally, it's data that's not used well, particularly at the minute, because like you say, it's free text, but also it's based on the internet, which is not something we traditionally think of as a source of health data. We're certainly in the health system very focused on using our own data that we get sent to us from hospitals and so on and so forth. But actually, exactly as Margaret was saying, the views and the opinions of patients and people using a service are hugely beneficial and give you a completely different viewpoint. So if you can harness that, it's you know, that's a big tick in the box, because you've done something really quite new and innovative in a way that is really very easily understood by the people that you're doing it for.
Rob, I know that you asked me to answer the question about how do you sort of build trust in the data, but I'd also like to sort of highlight you as a model of excellence. And I say that because of your openness to doing new things. And so I say the challenge to all of you here that if you haven't thought about re-equipping in AI, think about it in whichever discipline you're in. And study isn't just for when you're 20 or 25, it's for every stage of life. And so I'm coming at this from a communications professional, but I've sort of been retraining in dying and palliative care. And so that sparked my interest in how you help those who are dying, how you help those who are bereaved, coming from a communications discipline. So that's the first thing I'd like to say. But also, how do you get people to trust in the data? Well, I think it's all, you always select the best. And I say that because Demos are excellent at this, the Centre for Social Media Analysis. They're great partners to work with. But also, the palliative care physicians, the lawyer, the ethicist that I'm working with on this project, they care about it passionately, and they've caught the vision. And just as Sarah has said, that these it's the voices of those who we are walking alongside. And also it's also how do we best support those who are working on the front line as well. So it's a nod to your work, Rob, and it's also the sense of how do you get people to trust in the data? Well, you get the best people involved in the scoping and the ongoing development of the project as well.
Sure. I think that it's time that we bring you in again if you want to. If you haven't got kind of opinion on that, we've got some other questions that are coming along. Did you want to say any more for the moment on anything that's been said or that you have not been able to cover thus far? Because Rob kindly helped me with some questions in the lead up, so I might even get him to pose them because he's kind of got it going on.
Sorry, you mean me? Sorry.
Yes, John, sorry.
You cut out. Sorry.
Because as I say, I've seemed to have lost my mojo this afternoon.
No, don't worry. No, I think sort of covered it from my point of view. I mean, as I say, trust in the data is such an important thing, and we're taking very small steps deliberately so that we don't, go crashing in in the desire to get ahead of the game, really. So I think it's very important.
Rob, would you like to lead on one of the questions that you thought of? We don't have any questions in the chat so far.
Sure, yeah. Well, it's something we talked about yesterday. Margaret and myself.
Yesterday they did have a pre-meet, so as many of them that could make it, which is really kind of them, because obviously it's a really big commitment today. And as I say, that's why I'm deferring to Rob, because he then wrote up afterwards like a very, very helpful colleague about all the different questions. So thanks, Rob. Please carry on.
Not at all. Yeah, I guess two things that would be interesting to hear about would be, I always like to ask people what's the most exciting thing you've seen in AI at the point of care. But prior to that, maybe what the pandemic is the obvious elephant in the room, isn't it? Margaret and I were discussing this yesterday, and I was saying I was very involved in the COVID planning in Northern Ireland, particularly the health resource planning, and it was both deeply frustrating and quite inspirational, because on the one hand, so Northern Ireland is pretty representative of the NHS. You've got a wealth of disparate clinical systems that do not talk to each other. All the important stuff's pen and paper, and trying to amass all that and manage a situation where suddenly the past doesn't predict the future like it has done for the last 50 years, where you just do not, I mean, we all remember early March and thinking, oh my goodness, what's going to happen now? Was you suddenly realize how unfit for purpose the data ecosystem in the NHS is when it comes to managing a pandemic. But on the other hand, people broke out of silos and got things done in a way that I've never seen in, I mean, I started working for the NHS when I was 17, so 20 years now. What's the feeling about where we go from here? And this is for everyone in the panel. Particularly what's the impact of the pandemic going to be on AI at point of care, if any? Maybe John, because we'll maybe go backwards.
Yeah, no problem. Well, I mean, certainly from our perspective, the pandemic has significantly accelerated, certainly in the corporate workspace, future of work, that sort of question of, blurred lines of, work-life balance, all that sort of stuff. It's accelerated to that point. A lot of companies are saying, what do we do? Do we go to some sort of hybrid setting? There's all sorts of buzzwords, going around, and of course, well-being crops up. And I think where we're at is, and where the technology can really help us is, and what we're looking to do is to, for instance, take well-being as an example. It's this global term, and if you go to 10 people, you'll get 10 different answers as to what well-being is. And there are plenty of models out there that tell you, about different types of well-being and different factors that influence well-being. But at the end of the day, what we can start to do now is use technology to measure it, and that's what we're doing. It's coming back to that starting point of, trying to get some sort of quantifying exactly what we're talking about here, so that we can start making some decisions. In lots of cases, the data's there to guide decision making and strategy in whatever format you want to use it in. But we're still in a world where a lot of people are making assumptions, global assumptions about things which aren't necessarily true. So I think it's there. I think the other thing is it's the speed. I mean, you just alluded to it, but again, speaking from our experience, at the moment businesses are still using engagement surveys that are 6 months old, and there's no relevance to them anymore. The speed of the world has moved on significantly. Those engagement surveys are out of date by the time they even, get collected. So, the data that we're looking at, and then where AI comes into it with, predictive analysis and that sort of thing, machine learning, is that it can increase the speed at which, we can get information for decision making. That would be where I think the global pandemic has absolutely accelerated the need for that.
I'm happy to jump in, Rob. I was at a funeral this morning. I wasn't at a funeral in person. I was at a funeral in a crematorium online of a very, very dear colleague who volunteered his time on the wards and also had a senior role within the NHS, and he died of COVID. The world has changed, and there will be lots of broken pieces that we will all need to help one another put back together again, because so many lives have been impacted by the pandemic. That said, we can't go back to the old way of working. The acceleration, which has been in major part due to AI and machine learning, has led to us doing things that we could never do before. I suppose on a more traditional research methods level, I've been working with Lancaster University Medical School on our deathbed etiquette, and we have been putting together focus groups of those who are working on the front line, and whether this etiquette could have legs beyond the Northwest. But I mention it because we could never do it at the speed that we could do it at before, because all of the focus groups would